Hello viewers, I am Dr. Nagesh, consultant endocrinologist, Nagesh Diabetes Thyroid and Endocrine Clinic, and I am here to talk about diabetes mellitus with you. Diabetes mellitus, commonly called diabetes, is the most common and often ignored chronic disease in the world. In India, approximately 10 crore people have diabetes and another 8 to 10 crore people are at risk of developing diabetes. So what exactly is diabetes and what are the major types of diabetes? Many people have this misconception that there are two major types of diabetes. In fact, there are many varieties of diabetes, which are commonly grouped into four categories. Type 1 diabetes, where you have a deficiency in the production of insulin, which is commonly seen in children but can be seen at any age. Type 2 diabetes, which is the most common type of diabetes seen in obese people, where your pancreas makes enough insulin, but your body is resistant to this insulin, the so-called insulin resistance. The third variety is gestational diabetes, which happens in pregnant women, which usually remits after pregnancy but can recur at any point of time in their life. And the fourth, which is called as the other specific types of diabetes, which includes pancreatic diabetes and diabetes due to genetic causes, the so-called monogenic diabetes. Many patients actually come to us with the misconception that diabetes means developing excessive urination, excessive thirst, excessive hunger, or losing weight. But these so-called osmotic symptoms are not often seen in a majority of diabetic people, and to exactly diagnose diabetes, you need to screen yourself at regular point of time and check whether your fasting blood glucose levels are below 126 milligrams per deciliter. Your post-meal blood glucose levels should be less than 200 milligrams per deciliter, and your HbA1c or the 3-month blood glucose average should be less than 6.5%. If it is above any of this, it probably means that you have diabetes and you need to consult your doctor. The major problem with diabetes is the fact that you develop complications in your blood vessels. If they are small blood vessels, you develop microvascular complications, which can involve the nerves causing neuropathy, causing symptoms like burning, numbness, and tingling in your feet. Nephropathy, where your kidney is involved, which is often the commonest cause of chronic kidney disease and renal death in people with diabetes. And the third is retinopathy, where diabetes involves the small vessels of your eye, causing retinal problems. The other variety of vascular complications or blood vessel complications you get in diabetes are macrovascular complications, where large vessels which supply the heart can be involved, leading to myocardial infarction or heart attacks, which is the commonest cause of death in diabetes. Strokes due to involvement of blood vessels in your brain. Blood vessels in your legs can cause amputations, or diabetes can also cause infections. And all these complications need to be addressed when you are managing diabetes, and control of diabetes does not mean control of your blood glucose levels alone. And this is the reason why we always urge our patients to get themselves checked at regular intervals for high blood glucose levels, consult your doctor, get yourself treated by the doctor at the earliest, and also screen yourself with tests to look at your liver function, your kidney function, your thyroid function, thyroid dysfunction is very common in diabetes. Get an annual ECG done and also get an annual retina examination done. So to conclude, the one message I'd like to give everybody who is watching this video is, if you have developed any of the symptoms which I've enumerated above, or if you think you have diabetes, please consult a doctor or your endocrinologist immediately. Get yourself checked for the presence of diabetes and its complications. Get treated by your endocrinologist and be on regular follow-up, at least a minimum 3 monthly regular follow-up with your endocrinologist, so that your diabetes is in control and you have a good quality of life. Thank you.